online resources for migraine surgery, readability and patient understanding. With the growing digitalization of health information, the Internet has become a primary source for patients to use to understand complex procedures. Research shows that low health literacy drives health disparities, worsens outcomes, and increases mortality. For this reason, it is crucial that online health information be written in a clear and accessible manner for its audience, particularly for highly specialized procedures such as migraine surgery, where informed decision-making requires comprehension of complex information. Unfortunately, previous studies have found that much of the online medical information often exceeds recommended readability levels. The aim of this study was to evaluate the readability of the most popular websites finding on Google providing patient information about the surgical treatment of migraine. We analyzed the first 11 websites in order of appearance, and collected a total of 31 articles from them. The 31 articles were extracted and assessed using 6 validated readability indices: Gunning-Fogg Index, Coleman, Liao Index, Flesch, Kincaid, Automated Readability Index, Simple Measure of Gobbledygook Index, and Flesch Reading Ease. These readability scores, except for the FRE, correspond to a school grade level. The higher the number, the more difficult the text is to read. Scores greater than 17 reflect university-level reading ability. 81.8% of websites were based in the US, 1 in the UK, and 1 in Switzerland. All websites were targeted toward patients. Most websites were produced by private clinics, followed in equal proportion by academic centers, physician private practices, and educational websites, and finally by professional societies. The mean readability level across all websites was higher than the NIH and AMA recommended 6th grade level. Readability varied significantly between websites. Some were more accessible, whereas others were highly complex. Anyhow, all readability indices used indicated scores consistent with difficult or college-level texts reading levels. Our data, consistent with previous studies, suggests that average patients may struggle to fully understand the material. Technical terminology, long sentences, and limited formatting or visual aids contributed to poor readability. Limitations were: only a small number of websites were analyzed and exclusive use of English. The analysis was based on a single search term. The metrics used do not account for multimedia elements and images. As many younger users increasingly obtain medical information from social media platforms and video-based content, future studies are therefore warranted to broaden the analysis and incorporate social media and video-based platforms. Online patient information on migraine surgery is generally written at a level that is too difficult for the average reader, posing barriers to informed decision-making. Improving accessibility through simpler language, glossaries and visual aids, and testing materials with users, could enhance patient understanding, autonomy, and engagement in healthcare decisions. Online resources.